Doctor, great to have you on as always. So are we in the endemic phase of the pandemic now?
You know, Marnie, most likely we are, but for the layperson or the public, I don't know that they really understand what endemic means. I think it's important to communicate that we are not in a phase of the pandemic where we were previously, where we faced unprecedented levels of death, where we had skyrocketing hospitalizations, where there were restrictions, where you could not move about freely, and there were limitations on tests to confirm whether or not you had been exposed and actually infected with coronavirus. And we should applaud that progress, but that does not mean that we can let our guard down. In public health, we have a toolkit. You've heard me mention that before. And we flex those tools depending on what the data shows us. And the data shows us we're no longer in an emergency phase, but the pandemic is still existing because roughly over 1,000 Americans are still dying weekly.
Right, we cannot become complacent, and we've got some more news on vaccines now. There's a new study that found people who only got their primary series of COVID vaccines lost protection against the virus after 6 months. Some analysis here published in the JAMA Network found overall protection fell 44% at 1 month to 21% at 6 months. The study's authors also stressed that vaccines are still extremely effective at reducing the risk of hospitalization and death. Does this indicate that vaccine confidence is still a concern and fatigue is also still an issue?
You know, vaccine confidence and fatigue were with us prior to the results of this study being released. I think the most important thing for everyone to understand is that if you have not received an updated bivalent COVID booster, you are not as protected as you could be. The study showed that monovalent vaccines, including those that were the mRNA, so the Pfizer and the Moderna, and other vaccines like the AstraZeneca, those have waning effectiveness. We knew that already. We knew that you probably were at your peak levels of effectiveness up to 4 months, and then you started a precipitous decline. We know that even those vaccines were most effective against preventing severe disease. What severe disease? Disease that causes you to be hospitalized, or unfortunately, disease that leads to death. So if you have not received the bivalent booster, which protects you against the currently circulating strains, which are those Omicron subvariants, then you don't have an appropriate level of protection. And yes, it will wane, but it will give you the extra boost against severe disease.
There's also a new study that identifies some of the earliest symptoms of colon cancer. More young adults apparently are getting diagnosed with this disease. Researchers at Washington University in St. Louis looked at about 5,000 people with early onset colon cancer, and they found a number of concerning symptoms. How concerning is this, and how early should people be getting screened as a result of this new data?
You know, Marnie, this is concerning, and we must do a better job at educating the public and educating young adults about their level of risk. We see that those who are in their 50s or 55, they're getting appropriate levels of screening, although we are still seeing people show up with advanced disease, which contributes to advanced mortality or death. The most important thing for people to know is that if you are 45 or even just about that age bracket, you should be having a conversation with your physician about getting screened for colon cancer. And even more importantly, you should understand those early onset symptoms that can be suggestive that you might have this diagnosis. And what are they? Are you having bouts of ongoing diarrhea? I'm not talking about a day of diarrhea or even 2 days of diarrhea. We're talking about diarrhea that persists throughout the week. Are you having rectal bleeding? Are you having abdominal pain or stomach aches? And what the study actually found, are you a person with iron deficiency anemia? If any of those signs or symptoms are true, you should be having a conversation with your physician. I recall when my physician first told me, I'm 47 now, about the age of 43, 44, because I'm African American, you should consider getting screened earlier because African Americans are showing up with later stage disease. So we just have to help the public understand what risks there are that are currently out there and how they can protect themselves.
Yeah. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.